Good afternoon, and thank you for coming to my presentation on patient and family engagement as a principle of care coordination. Care coordination is an essential component of any effective healthcare system. Through an effective and efficient care coordination system, medical interventions can be carried out more holistically through the engagement of caregivers, other medical professionals, and family members to ensure quality healthcare outcomes. Through care coordination, medical interventions are patient centered and the needs of the patients are prioritized. Being a team based approach to healthcare, it is essential to have guiding rules for care coordination. These guiding rules form the fundamental components. To better understand care coordination, it is important to look at the fundamental principles of such. Family and patient engagement are important principles. O'Malley et al., 2019. Clinical settings are characterized by physicians working tirelessly to provide much needed quality care to patients in an increasingly inefficient and stressful work environment, with several medical emergencies and healthcare demands. However, some clinical structures are usually not properly streamlined to support their efforts in responding to the patient's needs as their care priority. A smooth care coordination system is one which can provide support to patients and their families that are involved as key drivers and designers in the treatment process. When patients, their families, and other caregivers are collectively engaged as active participants in the determination and coordination of the treatment process, health outcomes and the cost of healthcare services can be substantially improved. Bodenheimer, 2017. In providing care coordination, the physician's responsibility is to offer clinical advice and bring medical knowledge regarding a patient's condition, intervention options, and possible outcomes based on their experience and scientific expertise. It is within the responsibility of patients, caregivers, and family members to bring personal knowledge on the suitability or lack thereof of different treatments for the patient's circumstances. With this information, the patient can be placed in the proper care option, leading to the achievement of quality healthcare outcomes. To ensure care coordination between patients, physicians, and families, physicians need to create effective communication channels between the three parties. Patients and their families may have an important message or knowledge about the condition or best medical intervention if their input is invited. Research indicates that patients possess expertise relating to healthcare based on the virtue of their personal experiences with their medical conditions. This majorly applies to patients suffering from chronic illnesses, mental health, or addiction to drugs. It is necessary to request the input of both the patients and their families when providing medical care. Bucknall et al., 2016. This can be achieved through several sessions within the duration of care. To ensure effective communication, it is important to create a rapport with the involved parties and establish trust. Victims of drug and substance abuse find it difficult to openly share their challenges and experiences with second parties due to the stigma related to such conditions. Medical practitioners should ensure they build a comfortable and open patient-doctor relationship to mitigate factors that will limit the patient from openly sharing their experiences, challenges, and symptoms. With this, patients will readily share their challenges, symptoms, and medical history. Ascertaining to such patients and their families confidentiality of any medical information will develop trust and more open conversations. Medical practitioners should ensure they involve patients and their families in making medical decisions. The responsibility of such decisions should be shared between patients, their families, and clinicians. This requires a shift in healthcare where patients, physicians, and families work together to manage complex conditions and make decisions based on the best scientific evidence and the patient's biological characteristics, preferences, values, and life circumstances. Victims of drug abuse who seek professional help often have initially struggled with cessation and have experiences regarding their capability and challenges in stopping. Involving them in making decisions is especially important in situations with different multiple care options, each with its potential benefits and harms, like different forms of therapy. Effective involvement of patients and family members in medical care by capitalizing on their experience with the disease or the patient potentially reduces medical costs and minimizes wastage. Upon engaging patients and families, medical practitioners can learn of previous unsuccessful medical interventions or experiences with previous cessation attempts, which will help prescribe a new course of treatment. Also, such knowledge will reduce redundant and unnecessary testing that has been done before. Willard Grace, 2016. Another strategy for engaging patients and families in medical care is providing leadership and accountability. This majorly applies to drug and substance abuse patients. It is the responsibility of medical practitioners to engage such patients and agree on short-term and long-term healthcare goals. This includes gradual cessation of abused drugs depending on the set timelines. Treatment goals also constitute attending several guidance and counseling sessions to aid in the cessation process. The physician should ensure accountability and the definition of roles to achieve such goals. Meaner et al., 2020. Families of substance and drug abuse patients should be given up-to-date information and be enlightened on the treatment goals of their patients. This is specifically helpful for outpatients who will need monitoring from family members in their homes. Coordinated care between family members and the physician will ensure seamless delivery of up-to-date progress of the patient in receiving drug abuse to the physician. Ethical standards are important aspects of nursing that provide standards that help nurses make informed decisions when evaluating the consequences of their actions to ensure safe and quality healthcare outcomes. This ethical code is very important in providing care coordination, as coordination of care involves engaging the patients to determine their preferred medical intervention. The ethical code of nursing obligates nurses to give patients autonomy to make their own medical decisions on treatment. However, nurses must consider certain ethical principles and standards regarding the patient's choice of care. Chen and Ayanen, 2015. They should ensure that such decisions meet and satisfy the ethical standards, and if not, should advise the patient on the best intervention. The principle of non-maleficence obligates nurses to cause no intentional harm to patients. This is essential in helping and advising a patient in choosing the most suitable medical intervention to achieve quality healthcare outcomes. Nurses are also obligated to provide patient-based care. This emphasizes the aspect of coordination of care where nurses engage the patient to determine their most preferred course of action and provide treatment according to the specific needs of the patients rather than the general treatment interventions. Ethical decisions positively impacts healthcare by ensuring the provision of quality and safe medical services. Through ethical decision making, nurses implement the most suitable medical intervention that will ensure patient safety and the achievement of quality healthcare. Ethical decision making also helps nurses choose the most effective course of action when the patient's preference does not conform to ethical standards. Through ethical decision making, the interests and the needs of the patients are met as nurses are obliged into providing patient-based care. Yang and Miners, 2015. Healthcare outcomes of coordination of care are affected by different healthcare policies. One of such policies is Health Insurance Portability and Accountability Act, HIPAA. HIPAA safeguards private health information by the standard for sensitive patient data protection and sharing. Many patients of drug and substance abuse prefer their medical information kept private and confidential. HIPAA compliant institutions, therefore, find it easy to deal with patients of drug and substance abuse in obtaining the necessary medical information due to assuredness of confidentiality. However, HIPAA also limits private health medical information sharing to non compliant institutions. Erlin, 2015. Treatment interventions of drug and substance abuse require coordination of care between family members and other specialists. HIPAA limits the sharing of medical information to such third parties, thus negatively impacting coordination of care and the quality of healthcare outcomes that would have been achieved through involving family members and other professionals.